Joining us from our Newsmax newsroom in South Florida, Nick Tate, the Newsmax deputy health editor. Also with us, Skyping in, Dr. Sanjay Jain, board certified physician and author of the new book, Optimal Living. Gentlemen, to you both, we thank you for your time. And Dr. Jain, let's begin with you. Did the Texas hospital seriously drop the ball by sending this man home just with antibiotics?
I mean, that's a huge understatement. They totally dropped the ball. And so we have, people singing the praises of the United States healthcare, and the very first diagnosis, we completely dropped the ball. So it's very frustrating. I'm actually myself personally upset that this happened, and I'm just like everybody else. How did this happen? The patient went to the hospital, ER the first time, was sent home, totally missed the fact that he went to Africa, then he comes back even sicker, and who knows what happened in between. So people are obviously very upset.
And doctor, let's be honest, when you hear those words, and I'm certainly no doctor or nurse, but you hear those words, I was in Africa, this amount of time, what's the protocol there in your opinion, right after that?
I mean, there's a lot of question marks. First of all, he was knowingly exposed to Ebola. The stories out there is that he actually carried a pregnant woman who had Ebola and took her to a clinic, and she was rejected, but he actually was exposed. He knew he was exposed. So here he is getting on a plane knowing that he was exposed, going to Brussels, then to Washington, D.C., transferring to a flight to Dallas. So who knows what's happened in between. So there should have been airport measures at the Liberia airport, but unfortunately he didn't have any fever. So how effective is the airport measures to stop people who don't have the early signs of Ebola to fly? So there's a lot of frustrations here. First of all, the airport security. Then we got the issue of the ER missing the diagnosis the first time. So there's a lot of issues, a lot of questions are being raised.
And a lot of those questions concern the way the news is being disseminated to us. Let me bring in Nick Tate from our Newsmax newsroom here in South Florida. Nick, health officials say they're closely monitoring a second possible Ebola patient who came into contact with the first man. And then you have that report from Hawaii today about someone else possibly presenting Ebola symptoms. Just how worried should we be about this disease spreading? And the bottom line, Nick, are we really safe?
You know, that's the question, JD. I think that these two cases, the second potential case in Texas and the other one in Hawaii, reflect the fact that we're going to see more cases of Ebola in this country. And I believe that, as Dr. Jain suggests, the fumbling of this case in Texas reflects that the assurances we've been giving in the last couple of weeks by health officials that U.S. hospitals are prepared to handle it, we'll catch it, we'll isolate it, we'll make sure that there isn't a risk to the public. There are really questions about that. Now, what we've been hearing is you shouldn't be too worried about Ebola because hospital standards and protocols are different here than in West Africa, but this case in Texas certainly raises questions about that. So it's really important, I think, for everybody to be really vigilant. The question I have is, will there be lessons learned from the Texas case that the CDC and hospital officials put in place elsewhere so there's a higher level of alert and the firewalls go up? I also have questions about whether we're doing enough at airports to track people who come in with fever and from West Africa who may in fact be carrying Ebola. Seems to me we need to be doing more than we're doing, and this case points that up.
And doctor, let me bring you in now. Like Nick said, a lot of people are saying, don't be concerned. We've got this under control. It's in Texas, Hawaii. But, you can even ask my children, and they're talking about it, and they're 12 and 10. So is there a certain amount of hysteria, you think, surrounding Ebola?
Got about 30 seconds, Sanjay.
Yeah, so the hysteria, there's nothing you can really do about it. So hysteria is not going to treat the issue or solve the issue. I agree with Nick that being vigilant is very important, educating your children, letting them know about the disease and how to be careful, washing your hands, and just being more mindful of knowing what's going on around you. So education is very important, especially for healthcare workers, people at the ER who are admitting these people, are actually seeing these people and getting the right protocol down.
Sanjay Jain and Nick Tate, we thank you for your comments. Now we invite you to stay with us for our next portion of America's Forum, and we will continue the discussion on Ebola and what may await us with the spread of this disease. We all hope it's not what it could be. That is straight ahead. More with Nick Tate and Dr. Sanjay Jain. Olga and I will be right back.